So in our practice, I think this is underappreciated, UTIs. I guess 10 million doctor visits per year. 44, yeah, that's maybe worldwide. 10 million doctor visits per year for UTIs. We know they're common, right? Now we have a solution to help these people, these women mostly, because 44% of them, they'll end up with a second UTI within 6 months. It's just absolutely unacceptable. These poor women going through this, and it affects your life, affects your gut. You have to go on antibiotics. It affects your intimacy. It's really something that we now have this turnkey product that can really help to get a leg up on this. So I would just say, number one, for me, it's been more of a questioning my patients, making sure that I'm not missing that, or if I read it on paperwork going, wait a minute, because these chronic infections, I mean, they just take down your immune system. Like there's only so many things to fight. So I'm being more cognizant of my patients, especially if they're women, saying, this is a problem for you. I have a solution for you. So that's number one thing. What we're getting at too is that the bacteria in these women who it's recurring, it's embedding into their bladder wall. So it's hiding in the bladder wall. And then when an insult comes or they're having intercourse or their immune system's down a little bit, the bacteria will come out and they'll get that fulminant infection. And you just chase it. And your antimicrobials, your antibiotics are just not working as well anymore at all. Even I saw that when I was practicing traditional medicine. Falling bladder, I know, right? So CranXym was created. It's a turnkey product for women or men. I just put a 90-year-old nursing home patient on CranXym to help because he has a catheter and he was getting infections every 6 weeks, was causing increased confusion, and I mean he was angry, and it's just a lot of malaise. So this has really helped him. We're going to talk about that case study.
Can I make a comment?
Yeah.
I'll you on that too. If you're seeing any elderly people, they don't typically get symptoms of like bladder issues. They just get upset and angry, and you think it's part of their dementia, and they have a UTI. So that is like with anybody over 80 that has any early dementia, they won't get symptoms of urinary issues, meaning like you did when you were 40 with a UTI. Your symptoms are cognitive issues. They'll be upset, they're more angry, they're more brain fogged, their dementia just instantly got worse in 2 days. You think, oh my gosh, they just slid downhill and they got a UTI.
Right, awesome point. That's a great point. And then you think too, the people over 80, they're not drinking enough water. I mean, they're just setting themselves up for UTI. Some of them indwelling catheters. So CranXym is really a powerful probiotic, which is the sun fiber. We have the cranberry extract, and then we put in some nattokinase. That was Jason's really nice addition to this. So the proanthocyanins, the PACs, those are available when the cranberry extract is combined with the sun fiber. So sun fiber is awesome for your gut health. So then you're not only strengthening and getting rid of the problem and helping to not have the bacteria in bed, you're also strengthening the gut. And the gut is so foundational that I love this product because it has that sun fiber in it. So that's showing that the pathogenic bacteria, they're not able to adhere that bladder wall anymore, which is really the problem. That's that recurrence, 44%. That's a lot. That's unacceptable. Bring the science to the doctors. Take care of it now. That's why I'm here. So again, that prebiotic stimulates the gut bacteria, minimize the harmful effects of bacteria. And then the nattokinase is an enzyme that has natural probiotic effects. It eliminates bacteria's ability to attach to the urinary tract, and it can break up the mucus because some of those infections are real mucousy. It can really help deal with that. And also in the protocol, if someone has an all-out UTI and you feel like you catch it early and it's not something that will kill them, like in an elderly, you got to act pretty quick. You can pair it with the CZyme. So the CZyme, again, is all about the mucus and really help cleaning that up, helping with that pain of that urinary tract infection. So Jason and I can share that protocol with you. It's, it's again, there's no protocols really in my office, so it's more of what's worked for them, but typically it's 1 to 2 of the CranXym and then pair it with 1 to 2 of the CZyme.
Have you played with it with any people that get intercourse from? All right, cool.
Is this the one? Here, we'll do the
This is
intercourse
the
one
9-year-old woman. That
Yeah, she's a 9-year-old
Yeah,
woman.
awesome.
Had to slow her down, right? So I had a 33-year-old who had probably, oh my goodness, 15 UTIs in her lifetime at least, and she'd just go abstinent, which just didn't work for her husband at all. So she just dealt with it, and it wasn't until I was like, hey, why? She said something like, I just finished up an antibiotic, and I was like, wait a minute. Started asking her, she's like, yeah, I get a UTI every time we have intercourse. Every time. And she's like, it's kind of really putting a damper on my marriage. She's like, I'm embarrassed. I don't know. And I'm like, well, this is what we're going to do. So I placed her on 2 CranXym before and after intercourse, and then 1 in the morning. And I think she ended up taking it for 3 mornings in a row because she just wanted to take it. And then she had no symptoms. And that was probably 6-7 weeks ago now, maybe. When I posted that, and she's still doing well, and her husband's really happy. So
Kelly, you see there's a correlation with you having to do something with the spouse as well?
Not at this. I keep that in mind. Sometimes I'll have them do like a ozone cream all over their genital area just to kind of like regulate it out. But as far as putting them on I haven't done that yet.
I look at treating the spouse as well.
Yeah.
Yeah, because
that's a
they're
great
usually
idea.
where they're.
Yeah, right.
It's not more for
Mel's
these
got
days.
a quick testimony as well.
What's that?
No, nothing more for
Oh,
these days.
never mind.
Mel does not.
The spouse.
So then this is that nursing home patient started to have some increased dementia, got really angry, and so they checked his urine. Sure enough, another UTI. Put him on the CranXym, and that the dose was 2 at the onset of symptoms. And he did have some, I think he had some burning, a little bit of burning, and so for him the burning went away, and he went back to his baseline, which was nice. Doctor kind of brought that up, and now he's on 1 every day. So we're gonna see where that takes us. He might have to go to 2 every day. It's helping his gut too, so I don't mind going up. The only caveat that I have come across is that if someone has a problem with oxalates, I don't know. Theoretically, it could become a problem. Like at a really higher dose. Mel, do you have any insight on that? Because you did okay
when
on
I took a higher dose. It wasn't.
and
It wasn't long term. It was like 2 days.
Yeah, it's not for an extended amount.
Right. I wouldn't.